Oh, as discussed, this week we're going to be looking at front-end processes with revenue cycle and reimbursement. In other words, these are the processes that involve the patient having contact with the healthcare system. Again, as they say here, this is front end. This is dealing with the actual patient engagement. So when we talk about revenue cycle, we're talking about the types of things that we talked about a lot in HIM 160. This includes the patient engagement. Registration is an often neglected one. That's the focus of this chapter. The middle processes deal with the resource tracking. And then finally, the back end. This is producing a claim, the revenue collection, etc. So with the front end, it all starts with the patient. The patient typically initiates the contact by scheduling services. There are some exceptions to this, but often this is the way it works in the medical office setting. Somebody calls for an appointment, somebody requests a referral to a specialist, and so on. The second step is there's prior authorization if required. If you want to see a specialist in orthopedic surgery or what have you, many times there'll have to be a referral from your primary. Finally, we have the registration. In other words, the patient has to show up, give the demographic information we see on a claim, their name, their address, the guarantor, their insurance information, all of that. And then finally, the financial counseling if needed. So to schedule the services, sometimes the patients will use a patient portal. If you're a member of Oregon Medical Group, you have MyChart. You can go and request an appointment and what have you. There'll be some cost sharing, in other words, some out-of-pocket cost, and there may be some pre-treatment cost estimates done by the provider. On the right-hand side of this, we see price transparency, and there are federal and or state regulations that require providers to make their standard or list prices that are available. This is illustrated in figures 9.2 and 9.3 in your text. With the prior authorization, this is basically obtaining approval from the health insurance company before we provide the services. This is very common, especially when a patient's going to have an expensive procedure. And with the prior authorization requirements, there's typically a protocol. What things are looking for, all these other different types of things. Sometimes it's done electronically and so on. With the patient intake, the patient has to register. And this is where a lot of things go off the rails. In the weekly announcement, I talked about how one organization I work for, their registration people really, instead of doing their due diligence and registering patients appropriately, they just made people new medical record numbers. And then the claims would go to the wrong medical record number and account, and they lost hundreds of thousands of dollars. In addition to collecting the insurance data, there has to be a signed agreement to fulfill financial obligations. In other words, for whatever the insurance company doesn't pay, the patient has to bear some financial responsibility. There's also a HIPAA authorization form, an advanced beneficiary notification of non-coverage. In other words, this is spelling out explicitly what the patient's responsibility is financially. In many large healthcare organizations, there's patient financial counseling, and this might involve healthcare payment plans, loans, drug copay cards, if it's an expensive biologic, and other things. And again, I'll let you do this, but this is just kind of a good walkthrough for you that's in your text. Olivia's has been Tony is prescribed a new drug for his asthma. The drug is not on the superpayer formulary, and therefore the copayment is going to be higher to the tune of 30% of the $3,110 that it costs a month. Olivia and Tony were able to locate information about a copay card that would reduce the copay amount to $0 for the drugs. And again, you see a lot of these that sometimes are available through the pharmacy benefit management company or also through the pharmaceutical company themselves. That's all I have for you. We'll see you online. Bye now.